Great. Well, welcome everybody. Thank you so much for joining the Alzheimer's Disease and Related Disorders Advisory Committee meeting today. I do have a couple of logistics reminders before I pass it off.
Recording in progress.
Ooh, got a little bit of an echo there. So we are meeting in a hybrid setting. So you see the folks there that are meeting at the Department of Aging. This webinar is also available via Zoom and by telephone. Live captioning is being streamed, and to enable that, you'll want to hit the CC or live transcript icon on your toolbar. We also have American Sign Language interpretation, and Marguerite is with us, as well as Alonzo, who will be facilitating the interpretation throughout the session. And lastly, the recording slides and transcripts will be posted to the California Health and Human Services Community Living webpage after the webinar. Thank you. We are saving time for public comments. So those of you joining us on your computer, you can use the Q&A function at any time to ask questions or make comments. And you can select the raise hand icon to be added to a queue for your commentary. If you're joining us by phone, you'll want to press *9 to be added to the queue, and we will unmute your line to hear from you directly. And with that, I would love to pass it off to Catherine Blakemore.
And good morning, everyone. And before we start, do we have a quorum?
We need to check with Los Angeles.
Right. So they're here. Los Angeles is here as well.
Let's check. Meg Barron, are you on the line? There they are.
Okay,
there they are.
great.
Yep.
Perfect.
She would be, I think, in participants, so we'll have to move her over. Sure. Nancy or Maria, please pull Kim McCoy-Wade over to panelist.
You got it.
All right, cool.
Perfect. We're good.
We're good.
Fabulous. I want to start by just welcoming everyone and thank everybody for their patience and flexibility as we figured out how to do this hybrid meeting. You will note that we have some additional assistance for which we're really grateful for. And so the staff from the Department of Aging are helping us in addition to Health and Human Services staff. So we're just thrilled to have both Amanda, who did a lot of meeting logistics for us, help along with Susan DeMarios with the agenda, and Julie Solier and her team. So I also want to just welcome our newest member, who is Barbara here today, or?
She's actually going to join beginning in the September meeting.
So we have a new member, Barbara McClendon, who is with the Alzheimer's Association, and she's serving in a provider capacity, and she will be joining us in September. But it's nice to have always a full complement of people for our meetings and our committee. So the next thing we're going to do is just do introductions of the committee members. And I think is there a list right here on the slide?
Oh yeah, could you advance to the roster slides and then we'll go back to the agenda.
Thanks so much. So I want to start by asking the vice chair of the commission, Derek Lamb, to introduce himself.
Thank you, Catherine. Derek Lamb, family member representative, also president CEO at ACC Senior Services, and so pleased to have serving as a vice chair to Catherine.
Thanks so much, Derek. Meg Barron. Maybe is Meg here?
You're muted, Meg. Let's make sure we can hear you. Hold on. Yeah, can't. Oh yeah, I'm not the host. What am I doing?
Okay, let's go back to Meg in a minute. And Julie, you want to introduce yourself?
Julie Julia, and this is the Secretary of the California Health and Human Services Agency, covering all of the Department of Public Health.
Fabulous. Thanks so much. And thanks for all your help with the meeting.
Yep, we hear you.
And
now.
this is Meg. Can you hear me?
We can.
Okay, good. Yeah.
welcome. Anything else you want to say by way of introduction?
I'm Meg Barron with the Alzheimer's Association. I oversee Central and Southern California.
Perfect. Thanks so much. Dr. Farias? Are you with us?
I'm Sarah Farias. I'm a professor in the Department of Neurology at UC Davis, and I direct our California-funded Alzheimer's Disease Center at UC Davis in Sacramento. And I'm happy to be here. Sorry I couldn't be there in person, but glad to join.
We're happy to have you. Thanks so much. Pam Montana?
Hi, obviously my name is Pam Montana. I'm currently living with Alzheimer's. I like to say I'm living well with Alzheimer's. I got my diagnosis in 2016, and I am very happy to be part of this committee.
Terrific. Welcome. Thank you. Andrea Roberts?
There we go.
Can you guys see me? Hi, everybody. This is Andrea Roberts, and I am living well with MCI, and I live in, of course, Southern California in a small town called Claremont, and I'm so happy to be here. And I'm also, I think I already mentioned, living well with MCI.
Perfect. Dr. Thompson?
Hi, everyone. Good morning. I'm Dolores Gallagher Thompson, and I'm a research professor at Stanford University School of Medicine. And I've done 25 years of research into caregiving, particularly caregiving for persons with living with Alzheimer's disease or other forms of dementia. And I'm happy to be part of this committee. Thank you.
Thanks so much. Dr. Mobley? He may not be here yet. Todd Shelter, I see you.
Hey, good morning, everybody. My name is Todd Shetter. I'm the Chief Operating Officer and partner of Active Care Living. We are a memory care provider. We have 8 communities in Southern California, San Diego, and Orange County. Purpose-built communities to care for folks with dementia. Exciting project starting off in June. We've been working with Molly Nocon at Noah's Homes and the San Diego Regional Center. We're going to begin admitting residents that have Down syndrome and dementia to live with our geriatric residents in a community setting in 2 of our communities in San Diego County.
Terrific. Thanks so much. Celine Regalia.
Good morning, everyone. I'm Celine Regalia, Executive Director of Collaborative Care in NAPA. And we've been an Alzheimer's Daycare Resource Center since 1999, and we have adult day health, hospice, palliative care at our organization, and team advocacy program. And happy to be here today.
And thanks for making the journey over. We appreciate that. Dr. Canio.
Hi, good morning. Wendy Canio, geriatrician and psychiatrist in Marin, Sonoma. I'm the mental health representative here. I am the regional lead for dementia care in the Northern California Kaiser Permanente.
Perfect. Okay, I think we have a really nice turnout. I'm really grateful that all of you made the effort one way or the other to be here. So thank you, everyone, including all of the people participating from Los Angeles as well, and other locations. The next thing we're going to do is just approve the March 2022 minutes. Has everyone had a chance to look at them? And are there any comments or corrections before we have a motion to approve? Okay, I'm not hearing any. Is there a motion to approve the minutes?
So approval.
Okay, I'll take Derek as the mover, and I can't quite tell who is the other person.
I'll second, Todd.
Okay, Todd, thank you so much. All in favor of approving the minutes, say aye.
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 Any opposition? And any abstentions? None. Okay, thank you for that. I'm just going to briefly just recap some of the things we're working on. And you'll also notice on the agenda, there's some discussion at the end, particularly related to the master plan for aging and the process for sort of influencing what happens next there. So we're going to be excited about that opportunity as well. In between this meeting and last, a small work group of us, Julie Silver, me, Andrea, and Pam met to provide some input about the Assembly Bill 1618, which has to do with the composition of this committee. We are really quite popular. Lots of people want to have a presentation on this committee, which is great. It'll provide some more diversity of opinions. But the primary purpose we were talking about in that committee was the current statute has much shorter term limits for people who have lived experience of dementia that are serving on the committee than other members. And we wanted to discuss the pros and cons of changing that. We actually very quickly reached a consensus that it should be equalizing the terms. And I'm really pleased to let you know that Jared, who works as the Ledge Director at the Alzheimer's Association, has informed us that that change was made in the statute, and he'll provide some other updates as we go through the legislation. But I think that's a really terrific step forward and recognizes the incredible value that people with lived experience bring to this advisory committee. Derek is going to be working with a small group in between this meeting and next to look at the impact of isolation on people living with dementia during the COVID shutdowns, particularly in facilities, and what we might do to sort of better balance protection of people's health with their mental health needs and the impact of social isolation. So it is likely that we'll have a presentation about that at our next meeting. I'm going to be working with Dr. Mobley and others about a presentation on the intersection of individuals with Down syndrome and dementia. Dr. Mobley reported at the last meeting kind of the research he's been doing on that. Todd is a person that has some expertise. Molly has some expertise. I've reached out to regional centers to sort of get some of their perspectives. So we'll be trying to put together a presentation about that for the next meeting. We also heard from Dr. Canio about the request about incapacity letters and the importance of just sort of better understanding, when someone has difficulty making decisions, what are the different options for ensuring that their wishes can be honored, but that they're also legally binding, and what are the mechanisms for that? So we'll be looking forward to a presentation in the future about that. There's some legislation actually pending on the topic of supported decision-making, and that might be a fruitful basis to combine with this issue in a subsequent meeting. So those are just quick updates. And I think with that, we're going to get right into the meat of our agenda. And that will take us to our dementia standards of care presentation and a discussion. We're really fortunate to have Dr. Mark, Dr. Ramos, and Lauren Grove. And we're also going to have joining in that presentation Meg Barron, who has an interest in that as well. And I think maybe Jared's joining us. So really, I think a lot of good information. And why don't we get started with that?
Those are Meg's slides if Meg wants, and Jared's slides if they want to start off, and then we'll go to Dr. Mark.
Does that make sense to start with Meg and Jared?
Sounds great to
me. I think you're on mute.
So I was going to say ours is just very short. It was just really to announce that we're very excited to be partnering with DHCS on Dementia Aware, and really kind of get the standards of care as a focal point for the council to make sure that this is a big point we're all looking at. So I don't know if you want us to go third, because everybody can get an understanding of it first.
Sure, that makes perfect sense. So is Dr. Mark going to be leading us off then?
Yep.
Excellent. Thank you so
much
for joining us again.
Okay, well, thank you so much for having me. It's really exciting work. So if you want to go, I just wanted to give a brief update on where we are with Dementia Care Aware. And the first thing I wanted to let everyone know is that we've updated the name to Dementia Care Aware to really put the focus on providing care, which is what we ultimately want to do. I also wanted to provide an update that CMS announced that the Home and Community-Based Services Spending Plan funds can now be spent through March 31st, 2025. a year longer than was previously approved. However, the total amount of funding, the 25 million, has remained unchanged. So we just got this information. We're sort of looking at what this may mean, but wanted to share it with folks. We also wanted to let folks know that we are on track to launch the training by July on dementiacareaware.org. So next slide. And this just provides a reminder of the phases that we're looking at in terms of dementia care aware. The first phase, focusing on looking at screening tools, developing the training, and making sure that continuing medical education, maintenance of certification, and other continuing education credits are available to providers for doing the training. And then the second phase will start in the fall, really focusing on evaluating the training, updating the training, creating supplemental trainings for other folks, as well as doing a lot of outreach and engagement to make sure that primary care providers throughout the state are aware of the training and know how to take the training. And then furthermore, providing practice level implementation support. We know that it's not enough just to have a provider take a training on doing a screening like this. It's really providing practice level support in terms of how they can implement it into their clinic workflow. Next slide. And as I had announced last time, we're thrilled to have UCSF on board as our contractor leading this work, and they are collaborating with UCs throughout the state, as well as with the Alzheimer's Association, to really reach providers in areas, some of the more rural areas of California. So UCSF has put together a dementia clinical advisory board to help inform the dementia care aware activities, which has been meeting. It's comprised of key stakeholders, including members of primary care provider organizations, community-based organizations, as well as dementia experts from UC campuses, from the 10 California Alzheimer's disease centers, as well as this very group. We have representatives as well. Next slide. And then just a brief reminder on SB 48, which established an annual cognitive health assessment as a Medi-Cal benefit for beneficiaries age 65 and older if they're not otherwise eligible for a similar assessment as part of Medicare. So obviously most folks 65 and older are going to be able to get this assessment through Medicare, but we do serve a small number of folks who only are on Medi-Cal. And then pending legislative appropriation, which hopefully will happen soon, Medi-Cal providers will be eligible to receive payment for this Medi-Cal benefit. And in order to receive this payment, they're required to take a training, and it's this dementia care aware training that will be the training that's required. So next slide. So I wanted to just talk a little bit more about the cognitive health assessment that UCSF is developing in collaboration with the Clinical Advisory Board and all of us. It's designed to be administered by primary care providers. So it includes initial assessments that are free to use, quick to administer, easy to score, validated in primary care, and available in multiple languages. And it's also designed such that assessments can be done by different members of the healthcare team. So it's not the primary provider that has to do everything. It can be done, in a team-based fashion. Next slide. And I'll just give a full credit to UCSF and Dr. Anna Chodas, who's leading that work, because I borrowed a lot of slides from her. She unfortunately was unable to, she's on vacation this week, otherwise she could present it to you all. But these beautiful slides are all hers. So this just gives a flavor of what the cognitive health assessment will entail. It's an annual assessment for folks 65 and older who don't already have dementia health diagnosis, and it allows to have improved awareness of for the primary care provider of cognitive and functional symptoms that could be dementia. And also it allows the provider and the patient and the caregiver to work together on a brain health plan, for all older adults, even if they don't have symptoms yet, or even if they don't have a diagnosis yet. And they've really developed it as part of 3 steps that they're calling head to toe, which is really nice. So the head being focusing on cognition and assessing cognition, the arms being focusing on function, and then the legs being focusing on, is there a support system in place? It can be done in 15 minutes, and it's available in any language, and there'll be, as part of the training, information on which screening tools have been validated in which languages. Next slide. So starting with the head, and I'm not going to go through this busy slide in depth, but really it's focusing on, history and signs. So asking the patient or the informant if there's been any concerning new cognitive symptoms, difficulty with memory, any changes in your mental abilities. And then if there's a caregiver or a friend or a partner, if there's someone else there with the older adult, asking the informant or the caregiver if they've noticed any changes in the patient's mental abilities. And then also there's a component of having assessment tools available that can help with an assessment, particularly if there's any concerning report of symptoms. Next slide. So next, moving down to the arms, is focusing on function, what people can do and what they might be having trouble doing. So in terms of history, asking questions like, do you need more help with daily tasks, maybe difficulty paying bills or other, things like that. Noticing if the patient might be having difficulty with self-care, weight loss, hygiene, asking the informant if they're there, similar questions, and then also providing some assessment tools that can be used with the patient and the informant. Next slide. And then finally, the legs are assessing the support system. So it's really asking if the patient has a support system. So, do they have a regular caregiver? And, many older adults coming in to see their primary care physician, they may be living alone, but just asking them, do they have maybe a child or other family member in the area that, they can lean on when they need extra assistance, and documenting who that person might be. And next slide. Now that this sort of gets at, after you do the screening, what are the next steps? Because that's what we really want to focus on, making sure we get people the care that they need. So in terms of cognition, there's next steps around, screening for other conditions that can cause problems with memory or cognition, like mental health conditions, substance abuse. Scheduling a more in-depth assessment, because this is really meant to be a brief initial assessment. Labs that might want to be ordered, imaging, when to refer sooner versus later, depending on what symptoms might be present. And then in terms of function, referring people to the support they may need, so caregiver support, in-home supportive services, et cetera. And then in terms of the support system, documenting who might be a caregiver or someone available to support the patient. Next slide. And this is just to remind folks that this is really just a start. It's not, it's not the end point. So it'll really start a longitudinal assessment of the patient. And, I mentioned that you can start a brain health plan before a diagnosis is made. And then also really focusing on additional resources that will, that the team will be working on developing, such as toolkits, next step in the assessment and care planning, that will all be available on Dementia Care Aware. Next slide. So the training itself is going to be case-based and interactive. We want to address key populations, including the non-English speaking population, those with comorbid substance abuse disorder or serious mental illness, people with disabilities, older adults experiencing homelessness. We also want to address how to do this assessment over the phone, asynchronously, and also by other team members. We recognize that, obviously telehealth is here to stay, and we want to make sure it's designed in such a way that it can be, done no matter how the visit is being conducted with a primary care physician. We are aiming to make this a 90-minute training, and it will have quizzes because it's be providing continuing education, which, that required to have those quizzes. Next slide. So I just want to again echo my thanks to Dr. Anna Chodos, leading our UCSF team and the entire team there. That's really been just a wonderful partner in getting this running. And with that, I don't know if you want to take questions now or move on and take them later.
Why don't I'm not seeing any, well, I can't really see anyone to see if they have questions, come to think of it. Does anyone have questions? Maybe speak up and we'll do a couple now and then we'll have some time at the end, I think.
This is Pam, Montana. I was curious, I think a lot of you know that I've been going to UCSF since, well, actually that's where I got my diagnosis, and I've just finished 2 clinical trials. Well, it was a year ago, but anyway. So my question is, oh shoot, I totally forgot what I was going to ask. Welcome to my world with Alzheimer's. It'll come back to me. I'm sorry.
No problem. We're happy to come back to you. I think there's a question in the room here.
I was just wondering if any of this is connecting with the work that IHI is doing around the age-friendly health systems.
I think if there, Dr. Mark, you're on mute. There you go.
Yeah, I was going to say, could someone just repeat the question? I had trouble hearing it.
I'm sorry. I was just wondering if any of this can connect or is connecting to the work that IHI is doing around age-friendly health systems.
So thanks for bringing that up. It's not directly connected to that, but we can certainly reach out to them. And, you know, we're trying to speak to all the folks working in this area and make sure efforts are coordinated. So we can certainly reach out to them.
Yeah, and the reason I bring it up is our organization is part of Providence Health System. And so they've adopted the age-friendly and are participating in a action community for PACE, and it would just be really great to bring some of these best practices, you know, forward in the age-friendly health system and be able to connect some of those dots.
I think I can comment on that. Yeah. So the age-friendly health system is the 4Ms, right? The mind, mobility, medications, what matters most. And this particular one is helping with the components of the mentation part. So, they think it gives people tools to be able to meet that part of the assessment, or not assessment, but the requirement for the age.
Great, thanks.
I remembered my question. It was, Jared's laughing at me. It was about what's the deal with having it be like starting at 65. Because I obviously got my diagnosis long before I was 65. I have people in my support group that are 40 that are progressing, you know, way faster than I am. And so I was just curious, is that kind of like something that is, you know, it needs to be 65, or could it be where they could help some of us that are coming in there, you know, early stage, early onset, I guess is the, you know, kind of was my diagnosis.
Yeah, thank you for bringing that up. And there was a lot of discussion around this because we do definitely recognize that there are, you know, folks who present much younger than 65, and we don't want to miss them. So, you know, I think the decision was made. It may not necessarily be appropriate to sort of screen everyone under 65, but we want to include in the training the fact that obviously people can present at under 65, and sort of focus on the fact that, you know, as I showed in sort of the head, arms, and legs, you know, way of remembering the screening, that it starts out with sort of asking if someone's had any trouble with their memory or had any trouble with their cognitive function. And so at any age, if someone reports that, they can then go through the rest of the screening and the rest of the, you know, sort of the rest of the algorithm. And so the training will very much help even when folks present younger than that. I don't know if that's helpful. And then maybe I can sort of back up and say there's already a way, even though the sort of, I mean, for folks who are younger than 65 and who are only on Medi-Cal, they wouldn't be able to bill for the screening under the one code that we'll have for 65 and older, but there's other ways that they can bill for that screening, because essentially the patient would be presenting with a complaint of, memory problems, and then the physician would be doing this whole workup essentially. So the physicians can still take the information from this training and apply it to folks who present younger. I don't know if that's.
I was just hoping they would know that there are a lot of people in early stage, and even though maybe they think that most folks are over 60 or 65, but as we all know, that's not the case. There's quite a few.
Yeah, well, thanks for raising that, because we haven't finalized the training yet. We're still working on it. So, we'll make sure that we really emphasize that in the training, that make sure that folks know to work things up if someone presents with any complaints younger.
Yeah, okay, thank you. Sorry for me, my brain messed up, but I guess you guys are know why. I don't have to be ashamed in this group.
I think it's great, and we appreciate your question. I thought we might just turn to
Recording
the.
in progress.
Hi, this is Andrea. I was wondering if I can add to pretty much add to what Pam was saying. Again, I was diagnosed at 52, and so part of the support group that I'm part of it's a big issue for younger people coming in with cognitive decline and not having the resources they need. My situation is a little different. I actually have Medicaid because I qualify because of my income. I should be eligible for Medicare because of the SSDI, but there's a lot of younger people, as Pam was mentioning, that are trying to go through the process of becoming eligible for SSDI. And there's just like a gap in regards to insurances, in regards to being able to have like a full assessment. So it's good to see that they're considering that. But a lot of people that have cognitive decline is not going to qualify for Medicare because they don't have SSDI. And then some people won't qualify because they don't meet the income qualification for Medicaid. So, I don't know if that'll be a different issue, but that would be nice if they can add that to the consideration.
Thank you. Yeah, the training is really designed for all providers, regardless of, obviously most providers take a variety of insurances. So, but thank you for raising the issues around coverage, which I agree can be major issues.
Yeah, thanks so much. I thought we might move on to Dr. Ramos's and Lauren Grove presentation, and then hopefully we'll have time at the end to ask a few more questions. Great questions, and I think some really good input into what Dr. Mark and her team is developing. So, Dr. Ramos and team.
Yes, good morning. So it's actually going to be Lauren Groves presenting, and
Great.
I will be available for any questions that we need additional help with. So I'll
Perfect. Thanks so much.
Lauren.
Welcome, Lauren.
Fantastic. Thank you, Dr. Ramos. Will anyone be able to pull up the slides for the group to see? And as we do that, I'll go ahead and just introduce myself and say good morning to everyone. Thank you for having me on today to talk with you about the Department of Public Health Standards of Dementia Care Work. My name is Lauren Groves, and I am the chief of the Alzheimer's disease section here within the Center for Healthy Communities. And I'm really excited to talk with you about the work that we're planning around standards of dementia care. And so many of you may be aware, and next slide, if it's available.
Laura?
Yes.
Sorry, our host's computer has frozen. Are you able to share your own slides?
Let me see if I can pull those up. Just one second. They're up. So let me see if I can do that.
Thanks so much, Lauren.
No problem. Can you see them now?
Sure can. Thank you.
Fantastic. Thank you, guys. So as many of you know, in the California State Budget Act of 21-22, we received about $24.5 million to run new Alzheimer's disease program work here at the Department of Public Health. And we had 5 main focus areas of funding. And one of those areas is our standards of dementia care. And that's what we're going to chat about today. And within that umbrella, we have 2 funding areas. We have $1.7 million for a statewide standards of dementia care model, as well as $2.12 million for predictive analytics. And when we're building out these 2 areas, we're really taking a look at our path forward document and the recommendations that were provided for standards of dementia care model. And when we look at the statewide model, what we have in our recommendations are to look for evidence-derived cognitive screening questions, as well as a hub and spoke model of training. And what's really great about the presentation Dr. Mark just gave is her team with Dementia Care Aware is really providing those services. And they're really taking the lead on that particular part of the standard of dementia care. So when we look at those recommendations, we also have a third area, which is how to integrate caregivers into care planning. And that's the area that we, as the Department of Public Health, are going to move forward for the standards of dementia care. Also, when we look at our predictive analytics, it's really intended to optimize primary care practices to identify high-risk individuals. And when we talk a little bit about this in detail, you might find that the conversation around 65 and younger might be relevant for predictive analytics and helping our primary care practices really calculate risk for those who are under 65 as well, and who may need to be screened earlier than that 65 age range. So once we got started and took a look at what we were going to do, what we've done over the last 6 months is really conduct over 20 key informant interviews. We've met with a lot of groups and a lot of experts in the field to make sure that what we propose and what we move forward will really align with the gaps in the continuum of care, and will also really provide a clear direction for our team. And so we met with the Alzheimer's disease centers here in California. We also met with the Department of Aging, also the Department of Healthcare Services. We've met with the Alzheimer's Association. We did meet with the representatives at the Dementia Care Aware program as well, to make sure what we were funding moving forward doesn't duplicate what they're doing and instead complements and enhances that work. We met with the Blue Zones group, and then also have had many conversations with a handful of predictive analytics experts to really understand what we can do in that arena as well. So for the standards of dementia care model direction, that's our $1.7 million. We're going to move forward. We're really looking at a multi-pronged approach. And one way is to look at it from a preventative standpoint. And then the other end, which we'll get to in just a moment, is to bookend the dementia care aware work with some clinical guidelines past diagnosis. So first and foremost, we want to look at what we can do in a prevention umbrella. We have experience with some peer-to-peer community programs through our Healthy Brain Initiative and the research funding we've currently provided. And we have a couple key programs that are able to really be implemented throughout the state, and we'll use best practices and successes that we've already seen for bringing caregivers as well as Alzheimer's patients in any stage of their disease to the table for looking at risk reduction and prevention models that can be implemented at a community level. We really want to focus this peer-to-peer. We've seen a lot of success in what peer-to-peer looks like for individuals. So really, often a caregiver before someone is necessarily a patient, but two loved ones coming together to a program to help with prevention or reducing their risk of Alzheimer's in the long run. We also want to really focus in on creating a public health prevention and risk reduction work group. And that work group will be an internal Department of Public Health work group that brings together individuals from all of our key programs. We know that prevention is so important to not just our program, but really these factors and these behavioral changes that can be made address our colleagues in hypertension, diabetes, also nutrition and education. And then we are looking at partnering with our substance abuse projects as well as our tobacco control projects to make sure we have a really standard and strong statement around prevention for dementia. So looking at how we can incorporate that and promote that across many different arenas and really try to educate on the fact that prevention is possible. And so we are looking at that as well. And then on the other side of Dementia Care Aware, we're looking at how we can integrate caregivers into care planning. And we want to do that through partnering with our CADCs to update the Alzheimer's clinical care guidelines. They haven't been updated since 2017, and a lot has changed in the arena and in the environment for Alzheimer's and dementia. And so we want to make sure this document is really up to date, accurate, and available for providers to use and to share with caregivers as well. You can see there's a lot of information about engaging with your community, some care planning information in this document, as well as what may be advanced planning, capacity, elder abuse, these other topics that go hand in hand with Alzheimer's once an individual is diagnosed. And then our third component of our standards of dementia care is predictive analytics. And as I mentioned before, it's really about integrating a predictive algorithm into provider practices. And so what we want to do is fund a program to study, fund a study to validate and identify sensitivity in underserved and underrepresented populations. So we find that there are algorithms that have been studied so far, and they have some baseline data and validity, and we want to continue that hard work that's happening so that we can have essentially a risk calculation that can be used by primary care provider practices and move forward with, any patient that comes in can really be provided with their risk level. And this is really good work that's moving forward, and it's already out there starting, and we want to make sure we're able to enhance it and improve it as we go forward. And then mostly at that point, just want to be available for questions. Like I said, I am very excited to see the work that Dr. Merck's team has been able to do. And we want to come now, and after doing some planning, come in and help enhance that on both ends of the continuum of dementia care. So I think, I can't see if there's questions, but I don't know if we want to take them. I can stop sharing though.
Okay, thank you. And thanks again for sharing. Does anyone have questions? It looks like Jared. I can't tell if that's Jared, is your hand up? No, that might be your cursor.
That's my cursor. So funny.
It was right on your forehead, Jared. It was a little unclear what was happening. Okay, does anyone have any questions of Lauren? Okay, I'm not seeing anything at the moment, so why don't we move on to Meg and Jared's slides, and then we can kind of come back to any questions.
Oh, thank you so much. And this is Meg Barron with the Alzheimer's Association. And we just wanted to give kind of a quick update on where we are with Dementia Care Aware. And first, just to say how excited we are to partner with DHCS on this grant. And just to remind everyone that based on our research, less than half of individuals living with dementia have a diagnosis. So we definitely have our work cut out for us. But our big announcement is we have hired a Dementia Care Aware director for our part of the participation. And his name is Ron Spingarn. And if you just flip to the next slide, just a little bit of history on Ron. He's been, of course, with us just a few weeks, but he is already off to a great start. So I'm hoping that he'll be in some of our meetings and be able to give some updates as well, but really looking forward to all the partnership we're going to have going forward. So that is just our big updates on that. And then I'll pass it over to Jared just to give one more. Thank you.
Yeah, thank you, Megan, and good morning, everyone. So again, really excited to hear about the progress on Dementia Care Aware and on the standards of care funding programs and CDPH as well. As Meg mentioned, we hear far too often from the folks who engage with us about, having their issues disregarded by their provider and having spent years trying to receive a diagnosis and you know, being able to receive an accurate and timely diagnosis has been a priority for us before advancing SB 48 last year, and then through that legislative process. And we're really hopeful. I mean, hearing about some of the updates that this will really engage providers and encourage them to be active in providing that type of care for their patients. And then, you know, are also hopeful, and I think this is kind of touched on a little bit in the presentation, that the benefits, particularly of dementia care aware, will be extended past the approximately 170,000 individuals who be direct beneficiaries of this program, particularly through the training that would be available for providers. So really, really excited to hear about that. And then seeing how these two things work in tandem, how Dementia Care Aware works in tandem with the programs that CDPH has talked about as well. And I think, you know, our most optimistic kind of hope from all of this work, and I think from everybody on the call, is that, you know, eventually these are taking steps to building an evidence-based consensus guidelines that really show better outcomes for dementia patients, all dementia patients in California. And so, you know, seeing kind of the work that's happening here and then thinking about what additional steps need to go into creating those evidence-based consensus guidelines is something that we'll be thinking about a lot, and are excited to continue these conversations and hear these conversations on the advisory committee. So, and really seeing these advance the master plan for aging as well, and the Alzheimer's Prevention Preparedness Task Force, of which this was one of the primary goals. So again, very appreciative of the work and excited to move forward.
Thanks so much, Jared and Megan. And I guess I want to just acknowledge, it's like always so exciting to me to see California at the forefront of moving systems forward. And I think this is a really good example of that. So I have kind of two questions. One, you know, there's the Medicare system, which people like me are part of. And got our little dementia screening, but is there a way that data at all can be used or informed? Because it just seems like a sort of rich data source of that information. And then the second question is, from each of the presenters' perspectives, is there a way that this committee could be helpful in the work that you're doing? I mean, certainly it's going to be helpful to us to be informed, but is there specific things that we could do that would be helpful? Is it possible for the committee members, if they wanted to attend as an observer, one of the trainings, just to better understand kind of the protocols and tools that are being used? I think that might, just off the top of my head, be helpful to people as this is going forward. So any thoughts?
I think as a committee member, I would love to participate in that training, because on the professional side, we also offer memory care for some of the residents. So I think this is going to be very beneficial.
Thanks. Yeah, so thank you for raising those questions. So the training will be web-based, and it will be open to anyone. So we would actually love it if all of you take the training. You're welcome to send feedback if you have feedback. It's going to be an iterative process. As I mentioned, we'll have something that we'll first put up, and then we'll be evaluating that and making changes. So would love it if all of you take the training, and we can certainly send, once the training is up, we can certainly send a link to all of you if that's what you'd like. And then I also wanted to just say that you all have already provided some great input into the training, whether you realize it or not. So, like we were already tracking that we need to make sure that the training, talks about the fact that folks younger than 65 can present with dementia, and, making sure that they get an appropriate workup. But we'll, that's been highlighted again. So we'll make sure that that makes its way into the training. I love the question about Medicare data. I think we'll have to take a little thought about that. And I don't know if CDPH has other thoughts. I think that would actually be a great project for, sort of one of our UC partners or one of our more academic partners, to see if they could, take what they can learn from the Medicare data and really put that together in a way that could help inform this work.
Thank you, Dr. Mark. I agree. I think that is something that we can think about a little bit more. I think it's a really good idea to consider all the data and how we might utilize that. So certainly we'll keep that in mind on our end as well. As far as specific things that can be done by this committee, I feel like the answer is definitely yes. But with us being in the planning stages right now, I think I don't have a specific thing to request or to invite you all to be part of, but as we continue planning and bringing this to the committee, I think it will be really invaluable to have your input and have you involved with specific pieces. So I think more to come on that, and I'm grateful that you are suggesting and volunteering to potentially do more with the program. So more to come on that. And then I also saw in the chat box before we move to other questions, there was a question about whether or not we would plan to include healthy lifestyle promotion in the updated care guidelines. And I will say absolutely. From the Department of Public Health standpoint, we very much plan to focus on some prevention and risk reduction messaging and getting that out with all of the documents that we create and all of the programs that we move forward. So definitely some healthy lifestyle promotion in that guidelines document. And then also, there's a question about wanting to hear more about how risk factor data is going to be disseminated to PCPs with a potential for a checklist through EMR. And right now we're looking at funding multiple practices to implement, promote, see how that will work and see where there's success. Integrating into the EMR is not always an option and it's not always feasible. And so while that may be one route, there may be other risk calculation that someone can do. We know that there are other healthcare topics or other health behaviors where you can enter some information into a calculator, see what the risk is, and it provides guidance on how to move forward from there. So we are being flexible right now on what that looks like, but entertaining all of those options based on the funding we're able to put out for that.
Well, fabulous. Thank you for that. And we really look forward to ongoing engagement, I think, with both of you. I think Jared now might have his hand up. It's not on his forehead.
I do. Oh, and it went down automatically. That's awesome. I think that this issue might have been touched on in some of the questions, and maybe you've already responded to it, but I wonder for the new Office of Medicare Innovation and Integration in DHCS, if there is potentially a role for them, an active role or an informal role in thinking about some of these data sets and integration of what's available in Medicare in this new program.
Yeah, no, thank you for raising that. And I was thinking about that. We are working very closely with them. And I know that we're certainly working on getting data for duals, that we have, where we are providing their Medicare or their Medicaid, their Medi-Cal benefit, and then Medicare is providing benefits through Medicare. But I will loop back with Anastasia and see if there's a way that we can collaborate with them on sort of this broader question, which is really not limited to duals. I think it's looking at pulling down Medicare data as a whole and seeing what we can learn from the screening that they're doing.
Thanks so much. Good questions. Any last question before we move on to our legislative and budget update from Jared? Yes, one question.
I don't know if you heard it, but when you expect the clinical care guidelines to be updated and out?
We don't have a timeline on it just yet. We were finalizing our key informant interviews and establishing what our next steps would be. But I think by the next meeting, I can provide more updates on that or in between meetings as well.
Thank you.
And that might be a place where this committee can be helpful, like as you're beginning as you're doing the work about the updates to the clinical care guidelines, maybe a presentation that we could then provide some input on would be, I think, helpful. And I think certainly there's people on this committee that have a lot of expertise in that area. So just to keep in your mind.
Thank you. Great idea.
Okay, I think Jared. Thank you so much for being here again and always willing to share your expertise and knowledge with the committee about where things are legislatively and budget and your work with us.
Yeah, of course. So thank you again, everybody. Again, my name is Jared Russo with the Alzheimer's Association. Can we go to the next slide?
Wait.
Oh, we are not taking a break. I'm the break.
Jared, did you see those slides?
So I sent over slides. I have the slides too, if
Yeah.
you want me to share.
Could you go ahead and share?
Yes, of course. Continue. Okay, and now you get to see my desktop. And let's see where I'm at. Okay, a little bit of a preview. So again, this is a continuation of the presentation that I gave in the last advisory committee. We've been, the association, tracking around 29 bills through the legislative process, 5 of which are Alzheimer's specific, which I'll go into more depth in a few minutes. And then all bills at this stage have moved through their first house, and either in their second houses or have been held for this session. And 2 of those bills are some of the Alzheimer's specific bills that I'll get into in a moment as well. So in addition to Alzheimer's specific bills, we track bills that we think are relevant to our population as well. And some of the issues that we've seen the legislature prioritize this year are around affordability and long-term services and supports. Conservatorship has been kind of a key topic this year as well. Law enforcement training, really a focus of one of our bills, as well as Alz LA, Orange County, and San Diego. Housing has been a huge issue, and the Aging and Long-Term Care Assembly Chair has really kind of focused on that issue as well, housing for aging Californians. And then home and community-based services. Not only did we see such a great investment from the HCBS services spending plan last year, but we've seen the legislature prioritize this issue in a number of ways this year as well, and have been weighing in on a various amount of bills. In addition to the legislative process, obviously the budget process has been something that we've all been watching, with a huge state surplus that we've been really excited about. In the governor's January and May proposals, we saw a focus on Alzheimer's, both in a continuation of the Healthy Brain Initiative funding, which we're really excited about seeing, not only a continuation, but an expansion on, and that's relevant to one of our sponsored bills as well. In addition to that, a huge investment in community health workers in the areas of climate impact, homelessness, and dementia. Again, something relevant to one of our bills as well, and really excited to see kind of what the role of community health workers and promoters can be in a more direct one-to-one support for individuals. And then lastly, obviously, the master plan for aging has been, a huge benefit to all of this policy work, both last year and this year now. And so seeing the continuation of the funding to advance in the implementation of the master plan, something that we were really excited about seeing in those proposals. And then lastly, I think it was just last week that the legislature agreed on their budget priorities. And so obviously there are a few more days, I think, less than a week in budget deliberations that are, probably happening as we speak. But in that legislative budget agreement, we also saw 20 million for Alzheimer's and dementia care pilot program. And I think that this has been a priority of Alz LA, Orange County, and San Diego as well. So just excited to see both a focus from the administration and the legislature, and are really hopeful that all of these programs are in the final budget, so that we can talk about these programs in future advisory committee meetings. For the Alzheimer's specific bills, again, these will, if you were with us last advisory committee, this will seem just as an update. The first bill that we talked about last time is AB 2175 by Assemblymember Rubio. This was again sponsored by ALS LA, Orange County, and San Diego, and it was focused on creating a California Wandering Task Force in the Department of Justice. And unfortunately, it was held in appropriations. I wanted to see if either Deborah or Barbara were on, and if they wanted to say anything about that bill before I move forward. And if not, that's okay as well. I'm not seeing anything. So the next Alzheimer's specific bill was something that was drafted by Assemblymember Vopel, the Vice Chair of the Aging and Long-Term Care Committee. This is focused on the Department of, it was originally, well, it is still designed around the Department of Aging, implementing a public awareness campaign, something that everybody here has I think, prioritized for a very long time now. We've seen funding for this through the fiscal year budget last year, and the amendments through the legislative process really had them focus on the needs of unpaid caregivers and education around unpaid caregivers. So that's something exciting to see. This bill continues to move forward, and I believe it's in Senate Health. And I think I did see Deborah raise her hand, so I wanted to make sure that she had a chance to talk about their bill.
Just very briefly, I believe that that bill is I think it will come back next year. I do think that there was some clarification that had to be made with the Department of Justice, so that they would see that it is not as expensive as they think it might be, and so we're hopeful. Hopefully, fingers crossed, it will be back. Thank you, Jarrett.
Of course, and the first bill that is one of our 3 Alzheimer's Association sponsored bill is SB 861 by Senator Limon. This again is focused on dementia care navigation through community health workers and promotores. For our association, we've had a number, at all of our chapters, a number of partnerships with promotores to provide dementia education in the community. And what we're hoping to advance to is, again, one-to-one dementia care navigation. The bill is designed to have this be a pass-through grant program through the Department of Aging. And again, we've been encouraged by the governor's proposal around community health workers, and are hopeful that there's going to be an opportunity to fund this effort as it moves forward. The bill right now is in the Assembly, in Assembly Aging and Long-Term Care. I don't believe that they have a bill hearing set yet, but we're excited for the bill to continue to move forward. We've had only positive engagement on this bill, which has been great. Unanimous support in the legislature, positive interactions with the administration, and then also with community organization representing promotores. So we're really encouraged by all of that, and are very hopeful for this effort for this year. In some ways, I believe echoing Deborah's comments around AB 2175, our second sponsored bill, AB 2583 by Assemblymember Mullen, was also held in appropriations. This was directly around dementia training for law enforcement or peace officers. It would have worked in 2 stages. One, providing training to existing training officers in their crisis intervention training that is already a legislative requirement. And then it would have extended to all officers by 2030. The bill did have a somewhat significant cost, around $13.5 million actually, for the implementation of the training for all officers, and then $1 million each year after that. And this is a bill just like our previous bill that had unanimous support. I mean, I think what we've seen in the legislature is that, you know, there is broad-based support for programs that support communities impacted by dementia and Alzheimer's, which is great, but obviously disappointing as well that some of these bills were held in appropriations. And just like Deborah had mentioned, I think we will also be moving forward with a bill similar to this for next year. And potentially with a different author, given some of the elections that are occurring both in the Assembly and for Congress. So we think that we're well positioned. We've had great engagement with POST, the Commission on Peace Officer Training and Standards. as well as law enforcement, because of some of the work that has already occurred in San Mateo as well as Los Angeles. So we're not stopping on this, and we're hopeful that there'll be some progress next year. The last bill that I'll mention is AB 1618, which, as Catherine had mentioned, does, and as everybody here knows, impacts both the Healthy Brain Initiative as well as the as well as this advisory committee. And so we, again, with this bill, have had unanimous support so far. The bill passed through Senate Health this week with unanimous support, actually yesterday. And so we're really excited to see it continue to move through the legislative process. I'll mention some of the updates on the bill, and then I'll also see if my colleague Amaranta Marcelos, who's on the call, if she has anything to add, because she's been really the primary person working on this bill for us in the legislature. But right now, as many of you know, the advisory committee is 14 members in statute. The bill, at the last update we spoke about, it would update it to 20 members, including first responders, a commissioner from the Commission on Aging, primary care physicians, an additional consumer organization representative, and then 2 representatives from the legislature. We also heard loud and clear from our work group meeting in between these 2 advisory committee meetings that removing the term limits for members living with Alzheimer's is a priority. And so that's something that we've included in the bill as well, and is reflected in the most updated bill. But there were a few new amendments that we decided to take through this last committee yesterday. And so in that work group meeting, we heard there was still some language, some stigmatizing language. And so it was really helpful to have that pulled out for us so that we could ask for those amendments to change that language. We also added local health representatives as a representative on the advisory committee, considering the role that local public health plays, particularly with the Healthy Brain Initiative. It seemed like something that made a lot of sense. There was a request through the process to modify language regarding caregivers to formal family paid and unpaid caregivers. I believe, and I'll check in with Amaranta to see if that's if I have that absolutely correct. Again, the term limits, we've worked to remove the term limits, but we want to also make sure that there is consolidation for term lengths to make sure that everybody else on the committee can serve 2 3-year terms. And if we just remove the term limits, we want to ensure that current members are able to serve the equivalent amount of time. So that's something that we're still working through, and want to make sure that that is reflected in the bill as needed. There was also conversation around uplifting diversity on the committee, and so language was added to prioritize that as well. And then lastly, through the committee consultant for Senate Health, they made a request that we amend the bill to include the ability for the Secretary of Health and Human Service to appoint additional members up to 25. So that was something that was requested last week, and we felt we needed to take that. So with that, I'll check to see if Amaranta has anything to add, and then that's the end of my slides if there are any questions. If Amaranta is on the call. If not, I hope that I got that all right. And then wanted to see if there are any
something like we're still working with the member on term limits, I think.
Hi, this is Amaranta Marcelos. So I was trying to type in something and I accidentally pressed the send. But regarding term limits, we are still working with the author's office and Ledge Council to figure out if this is something that we need to do in code to ensure that the 2 current members have their full time on the board, or if this is something that we can leave to HHS. And regarding this final amendment, this is something that the committee council felt strongly about. So in the future, if there's any additional people that feel the need to be a part of this committee, we wouldn't have to go back to the legislature to add them. It would be a decision of
the HHS General Secretary.
Perfect. Thanks so much for those additions, and thank you also, Jared, for your presentation. Any quick questions? If I can't see the screen, I don't know.
Let's see. We have nothing.
No questions. Okay. Susan DeMoros I'm sorry, was there a question? I was just, yeah, Susan had requested to provide us with an update from CDA and the Master Plan for Aging, which we're going to be excited to get. So
Great.
love that.
Good morning, everyone, and I will keep this quick. The first suggestion I have is with the two bills that were discussed, the Wandering Task Force and the Mullen bill. I wanted to remind the group about the Elder and Disability Justice Coordinating Council that was established this year, and it's a joint effort between the California Health and Human Services Agency and the Department of Justice, staffed by CDA. If we can help you with the presentation, perhaps you could join efforts and bring a presentation to that group this year to inform that council on the two. They're related somewhat, and they both had a role for the Department of Justice. So we'd be happy to work with you on that. A few just real rapid fire updates from the Department of Aging. You may recall that the $5 million was included in last year's budget, this year's budget, to relaunch the Alzheimer's daycare resource centers. And we have been working closely with our partners, our adult daycare and adult day healthcare partners, and we're preparing to release a request for grants this summer. So perhaps as early as next month. So that's underway. The Department of Aging is in final interviews now for our first Alzheimer's specialist, who will join us likely in July. We also have launched our Office of the Patient Representative, headed by Susan Rodriguez. This office focuses on nursing homes and laser focused on providing representation for nursing home residents who lack capacity and lack a representative. So not everyone has Alzheimer's or dementia, but many of the residents who we will be supporting do have Alzheimer's and dementia. We're also very proud that we submitted to the Administration on Community Living a statewide grant built. We don't know if we'll be funded, so I don't want to spend a lot of time on this, but we're hopeful that our dementia care navigation model that's embedded in the triple area agencies on aging and aging and disability resource connections using community health workers. We're very hopeful that that will be funded and we can build off of that. Just yesterday, we had one of our successful webinar Wednesdays, and the focus was on Alzheimer's and dementia. We had about 130 participants and an excellent panel.
I think it was Andrea on that panel.
And we had a fabulous panelist.
Yes, I was.
Yes. Thank you, Catherine, for reminding me. You did a fantastic job yesterday.
Thank
you. We're thrilled that the governors may revise shifted responsibility for administration of the caregiver resource centers to the Department of Aging. That we heard from Catherine that she loved when California is in the forefront. The CRCs are a model to the nation. They will be housed at the Department of Aging. Their focus and their role and their responsibility will be unchanged, but it's an administrative shift that really helps build out that caregiving footprint at the Department of Aging. We continue our work on the no wrong door system, the single point of entry for older adults, people with disabilities, and family caregivers. This was key to both the Master Plan for Aging, and there was a digital portal recommendation in the Alzheimer's task force report. So we're continuing that work and investing heavily in an invisible way in IT, that background, the infrastructure to support that, and you'll be hearing more about that. Our department's also still very, very active on the COVID-19 front, working closely with the Department of Public Health on continuing to get messaging out about vaccines, boosters, and new treatment options, so that people who are diagnosed immediately go to embark on treatment for COVID-19. And last, not last, two more things. Our long-term care ombudsman, Blanca Castro, has been very active around the state. We've had a number of facility closures, including some very large, significant ones that have been proposed. And the ombudsman team is working closely with communities on that. And then finally, we had a very successful collaboration around World Elder Abuse Awareness Day, and we did a joint educational event that was very well received, where we featured a documentary film to what Derek will be working on about loneliness and isolation and how that relates to elder abuse. We did that with the Department of Rehabilitation and the Department of Social Services last week. Very, very well received, and an excellent panel for that. That's all I wanted you to
So many good
hear
things.
about, and there's more, but that's all that's Alzheimer's and dementia and caregiving.
That's great. And I think that I worked a lot on a prior version of this office of patient representative. It's really important, and I'm grateful you're taking it on. I actually think it fits in potentially as a piece if we're going to talk about sort of decision making for people who may lack capacity or need support in exercising their choices. So when we put that together for later this year, we could maybe work with your team on that. So that would be amazing. Perfect. Okay, any questions for Susan? Not seeing any. So I think we are at our scheduled break time, which is supposed to be 15 minutes. So we're actually 5 minutes ahead even, yay us. So if you could be back on Zoom at 11:30, 15 minutes, right? Am I right about that? 11:35. That would be terrific. Thanks so much, everyone, for a great start to our meeting.
All right, I see Meg walking back in.
Okay, so I think we are back. Thanks for returning promptly because we have other exciting things to talk about in the next half of our meeting. I did want to let you know that Amanda will be working with the Health and Human Services team to get all of the presentations posted. The easiest way to find them is to go to the chhs.ca.gov website, and then at the top on the right it says committees, and if you click on committees, we happen to be the very first one, the advantage of being an A committee. And if you look under that for meetings and look at the June meeting within a couple of days or so, all of the slides will be posted there. So thanks for making that easy for all of us. Appreciate that. Okay, I think we are now going to be talking about the Healthy Brain Initiative, some updates and discussion. So Dr. Ramos, you are listed, and as is Lauren for this. I'm not sure which one of you is presenting.
Hi, good morning again. It'll be Lauren presenting as well on this one.
Perfect. Welcome
All
back.
right. Thank you. Well, I will be spending the next few minutes just chatting with everyone about the Healthy Brain Initiative. If you can go to the next slide. So for this conversation today, we'll be talking about an update on where the initiative currently is for our pilot projects. We'll also be discussing the success of our pilot projects and then next steps with the Healthy Brain Initiative. So with that in mind, just a little bit of information to note and to set context. The purpose of the California Healthy Brain Initiative is to advance cognitive health as an integral component of public health in each county funded. It's also, in order to do that, we asked the projects to implement the CDC Healthy Brain Initiative Roadmap. And for our pilot projects, we were able to fund 6 public health departments, which included Los Angeles, Placer, Sacramento, San Diego, Santa Clara, and Shasta. And each of these projects were funded $750,000 per year for 2 years. Next slide. So the focus of the work for the Healthy Brain Initiative activities really included the 4 traditional domains of public health, which are to educate and empower community members about brain health and cognitive decline, develop policies and mobilize partnerships to support health efforts and find solutions, assure a competent workforce with workers who are meeting essential competencies, and then lastly, monitor and evaluate the health status of populations for identifying and resolving health issues and assessing the effectiveness, accessibility, and quality of healthcare services and programs. Next slide. So what I'm going to do now is just show a few highlights from some of our projects now that we have the baseline of what was funded. So Los Angeles County is the first one, and you'll see here on the slide their webpage as well as a few events they're hosting and documents they created. But for Los Angeles County, what's really exciting is they created a culturally tailored community education curriculum for their area. They have also hosted over 20 webinars for healthcare professionals and have made over 50 unique social media posts already in the program. Next slide. You'll see here as well, Placer County website and some of their media campaign. They also implemented Project Lifesaver, which is a really neat program with emergency preparedness around a lost patient with dementia. And they have really reduced the time in Placer County that someone is found if they are lost. And they also developed a Placer County transportation guide for seniors and became a virtual dementia tour license provider, as well as created and disseminated multiple education videos throughout the 2 years of funding. Next slide. In Sacramento County, we also found the program implemented dementia dialogues, as well as the 10 warning signs of Alzheimer's disease in the county. They had a bilingual media campaign that was really successful for Sacramento County, and they provided technical assistance to the Department of Children, Family, and Adult Services, specifically around brain health. And one of the really neat things that Sacramento County also has done is they partnered with CSUS for their student-led medical clinics and really focused on provider training for students. And so that was a really big step for Sacramento County as well. Next slide. For San Diego, they also really did a lot of work around monitoring and evaluating Alzheimer's disease. They have great annual plans and evaluation documents and very clear understanding of the environment around Alzheimer's in their county. And they use that information to update their caregiver handbook to be very specific to the data that they found. They also worked with 2 federally qualified health centers to adopt physician guidelines around dementia. And they integrated the Alzheimer's messaging into their public health work across all of their public health work. So they've done a really great job collaborating with the other areas of public health in their health department. They also developed a really strong provider training series that they have available virtual as well. Next slide. Santa Clara County implemented a media campaign titled Know Where Alzheimer's and All Dementia Hide, and it had over 4 million impressions. They've been our most successful media campaign out of our 6 projects and have continued to run that throughout their program. They also held many healthy brain workshops, and on the right here, you're going to see the title page, but they contributed to the Santa Clara County Medical Association's quarterly magazine. And they did that to feature articles on brain health, and a whole chapter of that quarterly magazine was around brain health, and they partnered on that initiative. And then our last program that was funded, our last pilot, was Shasta County, and Shasta County was able to run a countywide health education campaign. And they also hosted a large number of lunch and learns and health fairs. They found those to be really successful for their community. And they hosted the Aging Life, Health, and Wellness Symposium in Shasta County as well, and brought in all of their education messaging, all of their prevention and risk reduction work to that particular symposium. They also have launched multiple 8-week caregiver support group cohorts. So in their county, they're working to make sure caregivers are have the support needed. And they provided emergency and disaster training for individuals living with Alzheimer's as well. So to ensure that they had a plan in place if there was an emergency and disaster in the area. We found that with both Shasta and Placer County, that was a really successful model in the rural parts of their counties and their communities. And we envision that will move forward as well. Next slide. So overall, we've had some successes with the initiative. That's a little bit around how they've been successful individually, but collectively, what's really great is they have met the purpose and the goal of this program and this initiative. They were able to integrate cognitive health into their countywide public health initiatives. And over the last few months, we've been having a lot of conversations with these projects on sustainability and how they continue to keep cognitive health in their public health initiatives moving forward. They were also able to really assess their local community and tailored their program to meet that community's needs. And so what's really great is you saw in those examples, they weren't all one size fit all programs. They provided slightly different information. They provided slightly different education and awareness programming based on what they had found in their assessment of their community. Also, they built great partnerships. So one of the things that has been really successful with the Healthy Brain Initiative is that partnerships have continued to grow in each of these 6 counties. And they started with some core partners they already had, some of the traditional public health partners that might be at the table, but they've brought on new partners as well. And for example, as I mentioned, in the rural parts of Placer and Shasta County, they brought in a lot of emergency and first responder groups, and that was a newer, less traditional partner for them. And we've seen that success in all of our counties. So you might be asking yourself, then what's next? I know earlier it was mentioned that in the new budget, we do expect to see $10 million of one-time funding through the general fund to be available until June 30th, 2025. And with that, we do plan to potentially continue supporting the current local health departments. So those 6 programs you just heard, we want to help them really build sustainability into their program and move that forward in the next 2 years. and then also fund new programs and new local health departments to take the lessons learned from our pilot projects and really implement in a more streamlined and efficient and faster manner. So we're really looking at ways that we can take this potential funding and have a big impact in more communities and continue the impact we currently have in the communities we funded. Next slide. So the future of Healthy Brain Initiative, or what we refer to as our Healthy Brain Initiative 2.0, is to, again, add a lot of focus on sustainability. We know that in order to really consider this an integral part of their health department and their public health work, it has to be sustainable. It can't be dependent just on funding. And so what we're looking for here are continued partners. And I just want to say a big thank you to Department of Aging as well as Department of Healthcare Services, because both were able to attend our most recent meeting with our projects and provided continued partnership past the funding. So they were able to find ways where they can help promote the trainings for dementia care aware in their communities for providers and continue those provider relationships that they have built, as well as working with aging friendly communities on the Department of Aging side too. So there are some great partnerships and sustainability projects beginning, and we want to continue to focus on that for the currently funded projects if they are funded again. In addition, we recognize that there's a strong need for these programs in more rural counties, and we know that we were not able to fund that in the past, and we'd like to put focus on looking at the rural counties. How can we get them more involved? How can we help them move forward and be part of this initiative? We also want to look at creating a train the trainer type program where we have a mentor-mentee relationship, and really we utilize the 6 counties that were funded previously to mentor new counties coming in so that we can look at how they're able to get off the ground faster than our first set of 6. They are able to implement programs that they know are successful. And potentially one of the things we heard and we want to build into this program is how do we assess the community appropriately at the beginning? How do we make sure we're meeting the need of our community? And that was some lessons learned on how to do that appropriately from our first 6 projects. And we want to take those lessons learned and make sure that our new projects are also able to have a strong community assessment and know exactly what their community needs moving forward and knows how to tailor their programs to that community. And then lastly, we also want to look at a best practice toolkit. So many of our projects, you heard some of the highlights of what they've done, but they have unique successes that can be replicated throughout the state and other areas. And we want to have those best practices in place and available for individuals and the new programs to come in, take a look at what's been successful and look at replicating and have all the tools they need to do that. So we're building out a best practice toolkit for the next round as well. With this in mind too, a few of the things to keep in mind that we do know were successful and have been talked about moving forward are, really the emphasis on healthy eating and moving curriculum, that was a big prevention and risk reduction message that resonated in communities, that the media campaigns and the public awareness campaigns really be tailored to the community and be specific to that area. We also learned that having a website with a resource library is really helpful. And so whether we look at doing that from a statewide standpoint or each county having a resource library, that has been an area of great success that we'd like to look into further. Also, with each of these programs, they found having a coalition or advisory council in their county led them to have more success in their area. So they didn't always necessarily start with a coalition, but they've built them over time, and they felt that that was a key to their success as well. Also, they have talked about one of the big issues moving forward they want to continue working on and could and should be worked on in counties and in communities is really IT connectivity for some of the rural areas. That ability to, when we move into a more virtual world where you can't have social interaction necessarily every day, how do we ensure that this population is getting IT connectivity and can participate in many of these programs that were created and will continue to exist. Next slide. So with that, I think I'm open to any questions, ideas, or thoughts from the group. Anything? Let me look and see if there's anything in the chat box or any hands up.
I don't know if they can hear you. Yeah, they can hear you. Hi, I do have a couple of questions. This is Andrea Robert, and these are more comments and concerns. So I have several, but it's not really the time to really collaborate on it. So I'm happy in regards to the community initiative, but one of my concerns is I'm just curious to know, like, just maybe like an example of like the BOLD grant. I'm just curious to know when people apply for those funding, is there a percentage of people that's getting that the funding is going to? Like, I noticed that I looked at one of the recipients that was getting funding, and when I looked at the breakdown in regard to demographic, there was like 2 to 5% underrepresented community. The majority of the community was non-African American or people of color. Most of them were mostly white. I'm talking like 80 to 90% of the population. And then when you, because I actually broke it down, and then there's like 2 to 5% of underserved communities. And so I'm just curious to know that when people apply for these grant monies, is it required that they allocate a percentage money to these communities? And then my other question is, if these programs are being implemented, how are they recruiting people that look like the people that they're going to be working with? And let me see, what was my other concern? Yeah, so that's my biggest concern, is because you see a lot of materials that say that people are in these communities, but because I've worked with grant-funded programs and got a chance to see what RFP looks like, I'm just curious to know, when you apply for these money, is a percentage of this grant going to people? Because when you look at the breakdown, again, it's showing 2 to 5% of people, underserved community, are actually getting money allocated to those programs. So I don't know if that makes sense.
It does. Thank you for your question and your feedback on that. For that, I would say, we're looking at writing the next RFA for this particular grant program, and it's something that we would consider how to address that in the RFA. I don't know that we would necessarily have a requirement for a certain amount of funding to any one community, because it depends on that county's breakdown and what is appropriate there. But our focus with this funding is for underserved and underrepresented communities. So we would address it in questions that we ask in the RFA. And I think I would welcome any suggestions on how we might do that moving forward, because we are in the development of what the RFA might look like. And we would be interested in ensuring that moving forward. We ask a lot of questions around, the community when we do this RFA, or when we do these types of RFAs, and we ask them those types of questions. But I think that certainly what I'm hearing is we can do better, and I am open to that moving forward.
Yeah, thank you. And I just wanted to add comment here also, is that yes, we absolutely know and understand and appreciate the importance of incorporating underserved populations, minoritized populations in addressing Alzheimer's and dementia initiatives. And absolutely, we hear you, and we would love any input, and we go out of our way to really try and incorporate direct activities that are focusing in underrepresented populations. But we can only do what the capacity of the public health department is, but we keep on trying to encourage. And thank you for bringing this up, but we are on the same page. We believe that equity and diversity are really critical in terms not only of prevention, but in terms of supporting and helping the caregivers and the populations that are impacted.
So thanks for that. And I think there's a question from Dr. Farias as well.
Yeah, I was just wondering if the curriculum that you mentioned about healthy eating and moving is available somewhere, or?
Great question. And we are in the process, this particular set of pilot projects end at the end of June. And so with the end of the grant program, we do collect those materials and we'll have them available and be reviewing them for sharing. Many of those materials were provided through partnerships with other programs in the county. And so we will have that available and certainly share that out as we can. We have been working at the Alzheimer's disease program to update our website as well to provide more of these resources for communities and providers to pull down the community-based documents when they can. So definitely something we'll share out. It looks a little different from one program to another, and that's part of when we were chatting about the continuum of care and some of these really successful peer-to-peer programs that have shown success. We want to bring those into, more of a toolkit of materials that are available, something that is a program that can be replicated in the right communities as well.
So it's Catherine. I just have a couple of comments. I'm not seeing anyone else, I guess, one of which is essentially, I really like the idea that you're developing the new, I call it RFP, but you're calling it something else, but I assume it's the same thing that counties would be responding to. And I wonder if it could include having them proactively identify the partners that they would be working with a focus on looking, for diverse partners, because it's easier to reach diverse communities, I think, if you have the right partners. And another example of a partner that I think would be helpful if it's in that county is the Aging and Disability Resource Center, just because of their connections to broad groups of people. So those are things I might consider as a way of sort of helping ensure that there's diversity in who the projects are serving. Are there other comments that people have or questions about the Healthy Brain Initiative?
Also piggybacking on that, you were talking about the success, or what the common thread was, the advisory committee as that, and I'm wondering if you're bringing that forward in the next proposals as a best practice, and maybe that's another way that you can make sure that as an advisory committee, it consists of the demographics and partners on that committee.
Yeah, I think both of those are great suggestions, and we are looking at the coalition or an advisory committee of some sort being, potential required activity to move the work forward, because we did see it so as a successful piece of implementing this work. And with that in mind, I think those are great ways to ensure we are meeting the diverse populations in California. So I really appreciate those suggestions, and again, welcome any others as well. I think as we build out, as someone mentioned, slightly different than RFP, but request for applications as opposed to a request for proposal, same idea. State, terminology for what differences are in existence. But, as we look to build that out, we would welcome suggestions on how to ensure that this program has the highest level of success moving forward, and that we really are having the impact that we're looking to have throughout the state.
And it does seem like there's some natural connections with the larger dementia care program that we talked about earlier, and how these programs might not duplicate that, I think is what you were talking about, but some that they could be sort of collaborative, I think, rather than kind of siloed, which seems less effective to me at least. So
definitely, it's one of the things we talked about in our last meeting with the group, was the importance of utilizing what is already out there in the community and already out in the Alzheimer's environment. And one of those things was exactly what you just mentioned, but the Dementia Care Aware provider training. It's going to exist. It's going to cover many of the topics. And one of the things that the Healthy Brain Initiative includes is provider education. And as opposed to creating new provider education for some of the topics that are covered in Dementia Care Aware, this is an opportunity for them to utilize what's provided already and really promote and educate providers on that training. So we're trying to find those natural connections as all of these programs are being built out.
that's fabulous. Anyone else on the committee have a question, a comment? Okay, I think we're a little bit ahead of schedule, and Amanda's going to let us know whether the next presentation is ready to go. And if not, we'll pivot.
I can start on the next presentation. I'm actually going to be joined by Nancy McPherson, who from AARP California. And I don't see her on the line yet. Let me take it up. Let me look. Got too many screens going. Nancy, are you here? And I'm trying to. No.
Would you like us to see if there's like just any public comment now, and then we could go back to it again at the end? Is that helpful?
She's here.
Oh, she's here. Excellent.
Okay, great.
So organized.
Perfect. Okay, I'll start us off. So hi, I'm Amanda Lawrence. I'm the project director for California's Master Plan for Aging. And I'm going to share with you today an exciting opportunity for this committee to provide input to the master plan for its 2023-2024 initiatives. This committee probably knows that every 2 years of the master plan, we set forth initiatives. We had 132 that we developed for the first 2 years of implementation. And so Nancy's going to talk a bit about an opportunity where we'd like to hear feedback or input from this committee. Nancy is with AARP California, and she is a member of our Impact Committee, which stands for Implementing the Master Plan for Aging in California Together. She is one of 9 members of that committee. They're really the advisory body over the master plan. They help ensure accountability. They recently released a progress report sort of on our first year of implementation, how they think we did. I'm going to go ahead and pop those in the chat. So I put a link in the chat that's to the committee. You can find out more information about them there, and then also to the report that they released. I will let Nancy go ahead. I'm going to hand it over to you, Nancy, to share a bit about September 20th event and your committee, and then I'll take it back and we'll talk about the process that we'll go through to get input from this committee, what the event's going to be like, etc. So welcome, Nancy. Are you able to unmute yourself?
Can you hear me?
Yes.
Great. Well, good morning, everyone. I'm so glad to be with you today. I'm actually in Sacramento today, meeting at our offices here. So you're not that far away if you're meeting in person, but I'm glad to join you virtually this morning. And thank you, Amanda, for describing a little bit of what the Impact Committee does as one of 7 stakeholder committees as we all work together on implementation and accountability of the Master Plan for Aging, some with very specific objectives. And the Impact Committee has the privilege of having a big picture of what's actually happening across the board with each one of the committees. And certainly the Alzheimer's Advisory Committee, just like the others, is really integral to the success in building an age and disability friendly state. One of the things that the Impact Committee noted in our report was that we had a little bit of concern about a need for increased alignment and coordination across all committees, because we think this would strengthen not just the MPA, but the effectiveness of all of our work, and then continued stakeholder engagement. So we all know what we are each doing and how our work is contributing overall to the work of advancing the MPA. The event that Amanda was talking about that's going to take place on September 20th, really a very exciting opportunity for us as a group to break down some silos and begin to look at what the top priorities are for each one of our committees, and to develop cohesion and perhaps even a more coordinated strategy so that the work that we're doing really helps the Master Plan for Aging initiatives move forward. The idea of the September 20th event, which is going to be called the California for All Ages and Abilities, a Day of Action, will be at the Sacramento Convention Center. And the idea comes from the White House Conference of Aging, which meets every decade to bring together key leaders across the nation who are working on aging issues and to develop priorities for the administration. This is very near and dear to ARP because our founder, Dr. Ethel Percy Andrus, was one of the original committee members under President Eisenhower's administration to actually help frame the 1961 Conference on Aging. And out of that, I'll tell you how significant it was. Out of that came the impetus for Medicare, when we all know how important that is to older adults in our country. So that California is going to do this, bringing together key stakeholders, members of all the committees, and other key leaders in our state will be provided an opportunity to participate in this first of its kind event in California. And hopefully this will be a time when aging and disability leaders can provide input to the state on the highest priorities that we want the administration to address in the next 2 years of the MPA. When the Impact Stakeholder Committee, and Amanda said that the report we did is in your packet when we released our report in April of this year, we actually offered a template for each one of the 7 committees to include their 2 to 3 top priorities for our committee for implementation, so we could put together a report on that. And at the conference on September 20th, we're asking each one of the committees to complete a template that actually brings forward your top 2 to 3 priorities that you want to be elevated for the next iteration of the MPA. And the California Department of Aging created the template so that we could have a structured and thoughtful approach to bringing these priorities forward. So, we have, as was already referenced, 132 cross-agency initiatives, but we want to highlight, bring forward the priorities that are most critical to each one of the committees. It will be interesting too to see where we align and where each of the committees, each with its own discrete body of work, has an opportunity to share things that they think are the most important. So we encourage you to think really boldly as we build on the wonderful momentum that is already in place to drive systems level change across the state, as we're trying to develop person-centered and equity-focused services, programs, networks, and policies. And then at the conference, time has been reserved for each of the Aging and Disability Committee and councils to present their platforms to the administration. And then those will be folded into a report coming out of the committee, the Conference on Aging work. And then we will all have a little bit of a North Star to follow as we continue to advocate strongly for things that we feel should be priorities. And we will all have a clear focus, hopefully, for our work. Amanda, was there anything else you'd like me to address?
I think you covered that beautifully. We can talk a bit more about the logistics with the group here. And you're welcome to stick around, Nancy, if you'd like. You have time. I'm sure people have questions. And I do encourage everyone to read that report. We're really grateful to the Impact Committee for developing this report. 2 of the things that they really highlighted is their 2 priorities is ending older adult homelessness and also like building out a very robust, comprehensive home and community-based services system with an underpinning there of really integrating and elevating equity throughout it all. So, this committee and actually, if we could look at the next slide, I'd like to just have everyone be able to see who all these other committees are that we're talking about. So if any of these committees would like to, build upon the 2 recommendations from Impact Committee, that is fine to do, or come up with like 2 to 3 completely new ones. So the committees we're referring to include the California Aging and Disability Research Partnership. That's our newest committee, and it advances age and disability focused research through university and state partnerships. We have the Elder and Disability Justice Coordinating Council that Susan referenced earlier, working to address abuse, neglect, exploitation, and fraud perpetrated against older adults and adults with disabilities. We have the Disability and Aging Community Living Advisory Committee. This was previously known as the Olmsted Committee. It's Olmsted 2.0. So they advise on community living, inclusion, and integration, and they've really been focused on housing, transportation, and HCBS. And then we have our Equity and Aging Advisory Committee. Derek, aren't you on that one?
Yes, I am.
Yes, double duty. So we have that committee as well that advises the MPA as well as the Department of Aging on how we are truly building out an equitable workforce and programs and services. And then Nancy here from the Impact Stakeholder Committee. So that's who we're referencing when we say that these committees are all invited to the September 20th event to provide a platform of 2 to 3 recommendations. I have developed the template that Nancy was referencing. It is in SurveyMonkey. What we'd love to do is for each committee to select either a work group or some sort of process as to how they would develop their 2 to 3 priorities. This is a smaller committee. We do have some with 40 plus people on it. So each committee is going to have to develop its own process for this. But we have time on the agenda today for us to discuss how you'd like to proceed with developing the recommendations. I'll pause there and just, would love to hear your thoughts. Do you think this is a valuable exercise?
I would agree, and I want to thank the Impact Committee and also the state of California to launch our own version of White House Conference on Aging. And speaking as a former, federal employee being involved with the Administration on Aging, staffing one of the White House Conference on Aging many, many years ago. There's really a value to have that a forum to really bring together advocates and experts to the same discussion and talk about how we can build a better aging services platform for the whole US. And now we're doing this in California. So I am very excited this is happening here in our state. Thank you.
So I guess one of my questions is is there a way in which this committee could get input from everyone about what their priorities would be using the SurveyMonkey? Maybe have a small group of people sort of consolidate that. And then would it work if we brought this back to our September 9th meeting, just to kind of get the whole committee to sort of weigh in about this? And then it would still be in time to utilize for the September 20th meeting. Does that work?
If you're comfortable right up to the deadline like that. Yeah. Yeah, that sounds great. I mean, we can share the template with you and then each one can individually fill it out, but then you send us the final template with the top 2
I
to
just
3.
thought we could, everybody could, I mean, it feels like one of the strengths of this committee is the diversity of people that are on it and looking at issues from different perspectives. And I think getting everybody's input that wants to participate, we'll just give them a deadline and then maybe work with the staff to identify a couple of people. If people are interested, they can express it today that could meet to look at everybody's input. And then everyone could have sort of the final, yes, this is what the committee says on September 9th. And I think that would feel like, everyone had the opportunity to participate, whether. And I'm a little unclear who participates on September 20th. So is it everybody's invited or?
Yes. So everyone is invited. It is open to the public. We want every committee member, if they can travel, we can help some folks with travel expenses. So we'll definitely focusing on the committees, governor's office, state staff that are leaders and state staff. Our philanthropic partners will be there as well. And so we are still developing the agenda. We're going to open registration, hoping in 2 weeks.
We even already have a calendar slip in our calendars for that.
Yeah, all right, did I already send it to you?
You did.
Oh, maybe
apparently.
I put it in the
looked and I'm
chat.
Like, I wonder if
Okay.
if I'm available, and there is this calendar stuff.
Okay. Cool, I'm glad you're invited. Yeah, so if I haven't already put it on your calendar, it'll be on your calendar later today. So we'll release the agenda soon along with registration instructions. We have time in the morning for the committees to actually each have a meeting. I think it's about 45 minutes that we set aside for each committee to meet on their own in a breakout, go over, I think, last minute platform, last minute conversations. And for a lot of committees, it's the first time they're ever meeting ever and face to face, since some of these committees are so new. So you'll have time at that day to talk amongst yourselves, and then you will present your platform to the entire conference attendees. Yeah. So we're working on it.
And I love that we have Derek, who's an experienced person with these kind of convening. So that's terrific.
That's many years.
So does that process make sense that I sort of just outline quickly to people? Everybody would have a chance to fill out a survey that sort of looked at their priorities. If you're interested in being on a group that would kind of read them all and come up with some recommended 2 or 3 suggestions that have sort of a unifying theme from this committee, then we'll consider that on the 9th. So maybe should we let one of you know if we're interested? What's the best way to kind of figure out who's interested in being in the work group? Julie or Amanda or Susan?
I think maybe for now, you can send it to me.
Okay, well, so if you're interested, let Julie know, and then we'll convene a smaller number of us to kind of go through the feedback. And I'm definitely interested, so you can.
Yeah.
And I bet Derek is too.
Right now, just to give show of hands.
Yeah, anybody else interested? Derek and I are interested.
It is so noted.
Sure. In this room, you and there.
And
Anybody else on the screen? I think we.
Yeah, I'm interested if that, this is Meg.
Okay, great. Okay, let's start with that group, and if people think there are others that are, if you decide you're interested, once you look at the survey and want to participate, please let Julie know. And I think this is just a fabulous opportunity, and what a good way to bring interested communities together to come up with some common ideas. So, and Nancy, thanks for joining us. It was really, really terrific to hear the overview and the vision from the impact committee. So such exciting times in California.
well, that was a quicker conversation than I thought it would be. Thank you for the volunteerism. So we're a little bit ahead of schedule.
That's okay, because I think so. We're going to move to public comment. Derek is going to take over the meeting at this point because I have to scoot out and do my grandchild care responsibilities, so I don't abandon them at soccer camp. I'm trying to reform my bad habits as a mother where I forgot to pick up people, so now I'm trying to help out. So I will leave, and I'm going to be here for a bit, but Derek was really gracious and offered to take over the next part of the meeting. So take it away, Derek.
Well, thank you, Catherine. So for those who are joining by the webinar meeting, please use the Q&A function so that you can ask a question or select the raise hand icon, and our moderator will announce your name one by one and we'll unmute your line. For those who are attending by phone, please press *9 on your dial pad and raise your hand, and the moderator will announce the last 4 digits of your phone number and will unmute your line. So anyone would like to give a public comment?
Hi, Derek. I just want to acknowledge something that was shared in the chat. For the record, Barbara McClendon's name. Barbara McClendon is with the Alzheimer's Los Angeles, not the Alzheimer's Association. So just want to make sure we have that on record.
Thank you.
And I'm not seeing any hands up, and I'm not seeing anything in the Q&A. It's a quiet group.
Anyone from the Los Angeles meeting room would like to, Meg or Andrea, would like to say something?
Nothing here at this time.
Any other guests joining by Zoom would like to raise a question or make a comment? Okay, so I guess we can end this segment early. And for those who have other questions, please, feel free to let us know later on, and we'll be able to address them, after the meeting. Thank you for the comment, Eric. Great to see you joining the meeting today. All right, the next item is to finalize our recommendations and items for the Health and Human Services Secretary. So just like the last meeting, we are going to have a round robin so that you can basically let us know how you feel about this meeting and what are some of the things you'd like to bring to the Secretary's attention. And staff will be taking notes of that and present a memo to the Secretary later. So anyone who would like to make any comments so that it will be brought forward to the Secretary.
Maybe before I'll leave, if you don't mind, I'll just say,
yes,
I really thought the presentation about dementia aware and care guidelines was really informative. And I really look forward to opportunities for this committee to continue to be involved as that progresses. I thought there was some very good feedback that occurred during that I hope could be shared with the Secretary about ways in which we thought there could be, we talked about the expanding that to make sure it was expanded sufficiently to include people who might develop Alzheimer's earlier. The idea of looking at Medicare data to see if that could inform things. There might have been another couple of those that I think are worth sharing. And then I would just want to commend the administration for really being at the forefront of looking at these issues and expanding it to individuals who wouldn't be covered by Medicare or have other access to the kinds of screening and tools that are going to be available as part of that. So that would be my big takeaway from the meeting.
Yeah, thank you, Catherine. I would like to add that I want to give kudos to the state of California for launching this upcoming conference, Reimagining Equity, Aging, Disability, and Youth as a part of it all. Is really a good way for us to bring together all the experts and providers and advocates to strategize how to move forward, with meaningful policies and implementation of services for people who are older adults and people with disabilities. The first of its kind in the state of California. Really look forward to seeing that happening. Also want to thank Jared for giving us very detailed updates, what's going on with the legislature and the budget. And please continue to do so we will stay on top. And also thanks to Susan for giving us some exciting news, about what's happening with the California Department of Aging. That's exciting to have like more than 10 different things going on at the same time. I think we have kept you very busy. So thank you so much. And also other presenters, for giving us those wonderful presentations. And so really appreciate that. Any other comments that you want to present to the Secretary? Please raise your hand.
Yes, I have a recommendation, Andrea Robert. So my recommendation would be that any partner that apply to the RFP, if there's some way that they can ensure that a percentage of funding go towards underrepresented company, because sometimes you see these RFP, they usually specify the amount of money that go to different areas. And I would really like to make a recommendation that there is a percentage of money going to these underserved community, because the language is saying it, but you don't really see those fundings and dollars going to these communities. So I would really like to see these RFP be specific in regarding addressing a percentage of money going toward these community. And not only that, addressing somehow how to recruit more people that can better help them recruit people of color.
Thank you.
And my comment would just be around standards of care. Just very inspired that the advisory committee is going to be involved in learning more about standards of care and advancing it. So I'm really pleased around that area.
Thanks to Andrea and Mac for the comments. Anyone else? Any comments from staff? Right.
I'm just so appreciative that everyone made this work so that we can have an official meeting, and that all of this good conversation and thoughtfulness and recommendations can reach the secretary in a timely way. Thank you so much.
I think I would just add just a special thanks to Meg for hosting a Los Angeles location, so we can meet our in-person requirement forums. Thank you again, Meg.
Absolutely. Well, I want to thank the staff as well, because they put a lot of time in carefully planning this, so that we have a meeting with a quorum. Really appreciate that. Really thinking out of the box how to make this up. Yeah, it's great. All right, any final comments from anyone? Right, hearing that is almost 12:28 right now. And without any other feedback, I would like to adjourn the meeting. Do we have a motion to adjourn the meeting? Okay, all right, any second?
Here, Meg.
All right, thank you. All right. All those in favor signal by saying aye.
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 All those opposed? Thank you very much. Meeting is officially adjourned. And see you next time. All right. Bye-bye.
Bye.